The next delegation is just an update of the opioid crisis update. I said just, it's not just. We've got Dr. Bellemere here and Dr. Sampson, and we have Dr. Fife here as well that's going to be available for contributions. And I don't know how many people know Kate Fife, but she's the new president and CEO of the Timmins District Hospital. Kate is one of those leaders that I've just talked about. She has been here approximately 6 months, 4 months. And she's played a leadership role in implementing many of the changes that the doctors have called for by bringing together the community agencies. She, by no stretch of the imagination, is a passive person in relation to her activities with these communities. She's a very active leader within the community, and we're very, very fortunate to have her in her role as leader of the Timmins District Hospital, as we are with Dr. Bellemere and Dr. Sampson. So we look with great interest the update of this initiative.
Thank you for having us again, Mayor Peary and Council. I just want to say Mel's report was amazing. I'm so glad I got to stay for that presentation. It was actually astonishing, and the amount of data she pulled together in that short period of time is actually mind-blowing. And I think this is a great lead into our presentation tonight, because we're actually focusing, I would say, really on 1.5 of those pillars when we look at what our presentation is today. So I think it'll be a great lead into what we're discussing today. So again, thanks so much for having us back. So we're here today to follow up on our presentation that we did at the end of October. And we're talking about the recent improvements and, of course, moving forward in our forward vision with respect to the opiate use disorder crisis here in Timmins. So just a quick reminder, Dave says I have to be done in 15 minutes this time, not a minute over. He's got a timer on. We need to remember that it's a medical condition, and we need to treat it as such initially.
I'll just go over the updates on the data of opiate issues here in Timmins. You may remember this slide from the first presentation, October 27th. I just have a few updates there. We all know that overdose-related deaths in Timmins in 2019 was at 20. Overdose-related deaths from January to December of this year will be over 20. The last time I presented this, I had the data till May 2020. At that time, overdose-related deaths, probable and suspected, were at 17. We know we'll be over 20 by the end of this year. In the last week, we've had 3 suspected overdose deaths again. And as you recall, the death rate per capita, like mentioned last time, for 2019 from the Chief Coroner Office of Ontario, Fort Timmins was sitting at 46.8. Again, almost 4 times as much as the Ontario average. Ontario provincial stats about opiates in 2019, Ontario became the province with the highest overdose death rates in Canada. In 2020, there's been a 38% increase in overdose deaths rates from 2019 level. The Chief Coroner Office projection for 2020 is that in Ontario, there'll be over 2,200 people will die from overdose in Ontario. This is more than half of the total overdose rates we saw in Canada in 2019. So the rates are quite astonishing and going up.
So with respect to our goals, if we go back and reflect to our last presentation, is we want to improve access to addiction services along the full continuum, as we discussed, people before they enter treatment right into discharge planning following treatment. We want, as Mel alluded to this in her presentation, barrier-free access for all people with addictions. We want a system that is easy to navigate and seamless to navigate, an umbrella model, like one-stop shopping for patients and people with addictions. We want to improve medical access and evidence-based treatment for substance use disorder. If we recall, it is a medical condition for all. And we also want to be able to meet Health Quality Ontario benchmarks for opioid use disorder. These are very important benchmarks to meet. As we know, they do save lives when we meet these benchmarks. It's also important to note recently mental health and addiction community organizations and services, including TDH, City of Timmins, CMHA, lead physicians, Ontario Health, have been meeting weekly to discuss recommendations and improvements in our services since October 13th. There's also been a project manager hired to assist with the development and structure as we move forward. So with respect to addiction services in Timmins, Mel actually talked about this too, mobile crisis and rapid response. This is a collaboration between TPS and social worker and nurses from the mental health department at the hospital. What they do is together they attend to patients in crisis and they assess these people and determine if they need to be brought to TDH, and they also ensure that they have appropriate follow-up with services. With respect to the successes there, because that's what our presentation focuses today, is to discuss successes, is that they find the service so far is operating well. They're still continuing to seek opportunities to support clients' needs. Again, it's fluid, it's always changing. They have definitely improved collaboration with the Emerge department, and they're prioritizing apprehended clients, and they're partnering with TPS and with the new program at the hospital called Community Withdrawal Management Support. When we look at the statistics for Timmins, we're comparing Q1 to Q2, and this is, if I recall, from April to September. Yeah, it's right there, April to September. We noted the red bar at the very end that mobile crisis has brought a lot more people to Timmins and District Hospital, and these people have been admitted. And this is a good thing. This means these people in our community are being identified sooner, and they're being brought in by the mobile crisis team and being treated and appropriately brought in to the inpatient unit at the hospital. This is not the mental health unit. These are people who have other acute medical conditions who are being admitted to hospital, but are actually initially being in contact with mobile crisis and TPS. With respect to Timmins Police Services, they actually started a new outreach and community safety team, which has been a fabulous contribution to the addiction and mental health services going on in Timmins. It's 2 police officers, and they're dedicated to servicing patients who are in need for mental health and addictions. They collaborate and assist outreach workers for social services. They connect with people with substance abuse treatment services in Timmins, and they collaborate with community organizations to improve access. They've been real benefit to Timmins, and this has started around the beginning of October. We also note there's been an increase in police presence in the downtown area of officers walking on the beat. Walking the beat, not on the beat. So with respect to Jubilee Safe Beds, and just a refresher, these are support beds if a person with an addiction or mental health is in crisis, and they can access these beds 24 hours a day, 7 days a week. During the City Council presentation on October 27th, at that time there was 0 safe bed occupancy since March of 2020. They were not accepting patients on OAT, Suboxone, or methadone for opioid addiction, and there was very strict admission criteria, and it was very difficult for, by that time, police had no access to safe beds. As of December 8th, which is today, right? Today, there's 6 safe beds are now open and occupied. They're now accepting patients on opiate agonist treatment, Suboxone and methadone, Monday to Friday during daytime hours. And currently they're working on towards increasing these hours and working on staffing. They're working on admission criteria that are less strict and barrier-free. And they are part of a joint planning to enable 24-hour on-site access to substance use disorder medication treatment with an on-call physician. Presently, patients need to be started in the emergency department, then transferred there. But the goal, hopefully, will be eventually that they can be started there also. And they're working towards increasing staffing to 24/7 via nurse and nurse practitioner. With respect to RAM, this is the Rapid Access Addiction Medicine Clinic, or it's located on 5th Avenue. It's presently open 3 afternoons per week. They offer treatment for substance use disorder. As of December 8th, there's also been lots of improvements there. There's better access from the Emerge department for appointments for patients. Patients at times can leave the ED with an appointment. There's improved communication between RAM and our new program at the hospital, which was just, there was just a media release for a community in-home mobile withdrawal services at TDH. There's also a RAM opiate navigator that at times will come into the hospital and see patients prior to discharge planning to ensure that they're hooked up with appropriate services prior to discharge. And we're continuing to monitor the need for improved access and hours availability. We're meeting biweekly with TDH, with the Addiction Medicine Consult team, again with the community mobile home withdrawal management to monitor changes and to continue to monitor gaps. How's my time? I'm okay? Okay. So you could shut my mic off. So Jubilee Residential Treatment. COVID has put significant limitations on occupancy of residential treatment programs like it has for many situations. We're working on solutions to enhance response to increasing local demand for residential treatment, rehab services, and of course we talked about this at length, day and evening program, which is of utmost importance in recovery for patients with substance use disorder. They need continued follow-up. And this is part of the Health Quality Ontario benchmarks that we need to be meeting. And this also improves our retention into treatment programs. It's also used that once people are done detox and patients are stabilized, they need continued support for ongoing treatment to help prevent relapse long-term. With respect to the overdose prevention site, which we spoke to this about also, it's currently in the initial steps underway. Again, it's a long process. It's a minimum of 1 year for what we call federal exemption. And currently right now we have medical residents from the Northern Ontario School of Medicine who have to do a research project, and they've been involved with starting the process of surveying the community and stakeholders in conjunction with community organizations as part of their research project. And we're actually collaborating with other northern communities who've had previous experience with their application for overdose prevention site. And the next step will be applying for doing a feasibility study will be the next step in order to apply for federal exemption.
Services at Timmins and District Hospital, services that have changed since our last presentation, October 27th. At TDH, we have new addiction services. We have the Addiction Medicine Consult Team, AMCT. We have the Community In-Home Mobile Withdrawal Management Services. And we now have the Acute In-Hospital Withdrawal Management Services. People know these as detox beds. So what is the AMCT, Addiction Medicine Consult Team? Well, this is a team of consultation and expert advice for people with substance use disorder that are admitted to the hospital, usually for other reasons. Patients get admitted for infections, for surgery, and they're found to have a substance use disorder. This team will assess the patient and give recommendations on treatment of their substance use disorder and start it while they're in the hospital. We provide links to the community services and discharge planning. This team includes a physician on call and a dedicated nurse that specializes in addiction that's available Monday to Friday, 8 to 4. We also have social work support in the hospital that helps with discharge planning, and other medical staff, of course, that help out. Since we started this in mid-October, the Acute Medicine Consult team had 9 referrals in October. In November, we had 11. We've already surpassed 11 now in December. Physician contact for these referrals, meaning phone calls, seeing patients in person, talking to the nurses. In October, at the startup, we had about 10 physician contact. In November, we were at 51. This is just us tracking how many times we're involved with these patients. The nurses are probably involved. The nurse in charge of this program is probably involved, has probably double that amount of contact because they do a lot of the calls as well. The Community In-Home Mobile Withdrawal Services. This is a model between the hospital and the community. Consultation, expert advice, again, for substance use disorder, alcohol, opiate. This is for people who want to withdraw at home or in a safe place, not including the hospital. So it's to be done at home, and it's supported, again, by physicians on call and a dedicated nurse that does this. And in the new year, we'll have a nurse practitioner who will be available to help out as well. We have collaboration with Mobile Crisis. If they have a patient that needs withdrawal management, we will link with them. And as well, the police often will call us when they pick up someone who wants to get off their medications, their drugs. We will collaborate with them to start this in the community. It could be in their home. It could be at Living Space. It could be in a shelter. We do the phone calls. We do the follow-ups. So again, since mid-October, we had 5 referrals in mid-October when it first started. In November, we are up to 21. Physician contact is a bit less because a lot of these contacts and the follow-ups are made by the nurse. She does a lot of the phone calls. She calls us then to collaborate with her, to send the prescriptions at the appropriate pharmacy, and she does a lot of the follow-up. We couldn't do this without her. It's really driven by nursing and nurse practitioner with us as a backup and support. It's been a great program and used a lot. And as of yesterday, we have the introduction of 2 acute withdrawal beds, known as detox beds. These will be at TDH, and they'll be supported by physicians on call, and as well the addiction medicine consult team nurse, social worker, and hospital staff. These beds are available as a short-term solution until a long-term solution in our city can be fixed. This is the hospital coming through for us, for the patients, to allow some detox beds in our community that is well needed. Detox beds that will offer evidence-based treatment for opiate agonist therapy, but also for alcohol withdrawal. So we see a lot of both. So far, we've had 1 bed that's been occupied since yesterday, since it's opened. And I'm sure they'll be occupied most of the time. So these beds will have low admission barriers. They'll be for people with acute withdrawal that want to quit their substance use. Average length of stay will be probably 3 to 5 days. And at that time, discharge planning will be done by social work and the nurse to get them into possibly other treatments such as residential or day or evening programs to continue their treatment.
Okay, with respect to other community services, went the wrong way. Living Space. So we've been in discussion and talks with Living Space about implementation of a primary care clinic in early 2021. This will be supported by physicians, nurse, and clerical staff located at Living Space. As we know, several people in homelessness do not have access to primary care physicians. So those are people that they like to see if they have, a cough, a cold, they need a mammogram, things like that. So it's medical services for people living in homelessness and with addictions. And there's still lots of information to come. We're working right now, Dr. Sampson and I are working on this with Living Space and getting a space going and servicing for these people. We're continuously, and Living Space is continuously working on housing strategies in collaboration with other community agencies to move people out of homelessness. Currently, their biggest referral still to Living Space is out of corrections. And since COVID, it's also been their biggest referral source is from relationship breakdowns due to COVID. With respect to housing and homelessness, currently there's been 22 individuals that have been housed from homelessness since September 1st. These are amazing numbers. This is in conjunction with community agencies working together, such as Living Space, CMHA, and DSAB. There's been 22 people released from incarceration into homelessness since October 1st. Still big numbers, but the nice thing is they're continuously working on improving discharge planning from incarceration through collaboration with correctional services, CMHA, and other agencies. We have to remember that since COVID, there's been reduced occupancy in correctional centers due to ministry guidelines. Almost done. So where are we going? We still have a long way to go. We've made some wonderful changes. We don't want to get comfortable. We still need to move forward. We need to continue to connect with community organizations. It's really important that we ensure accountability for addiction services available in our city and district. We need to reflect on the needs-based planning research for addiction treatment. We must consider an umbrella model of care where there's one lead organization which ensures barrier-free and seamless navigation of people requiring treatment for addictions. This will be one-stop shopping under one roof, and this is what's ideal for patients with addictions. We need to provide evidence-based medical treatment for substance use disorder and meet Health Quality Ontario benchmarks for opiate use disorder. And of course, we need to improve access to services, reduce wait times for patients requiring addiction treatment, including acute medical treatment, short and long-term residential, day and evening program in our community. And we need to improve homelessness along with improved addictions care. So again, Dr. Sampson and I had put these visions forward with respect to addiction services in Timmins during our first presentation. They're always in the back of our mind as we continue to move forward. And that is that the people of Northern Ontario with substance use disorder will have an integrated, comprehensive, and concurrent treatment of their addiction, physical health, mental health, social and cultural needs. Treatment is offered according to best practice and evidence-based care to improve retention and outcomes and subsequently reduce mortality and morbidity. Community partners will continue to come together united without judgment to embrace the changes necessary to improve the current state of addictions and ensure we are following evidence-based practice and meeting the needs and demands for people with addictions in our community. We must ensure that the person/patient with an addiction is number one, and we put our biases aside and become comfortable with the unfamiliar. I think that's it.
Comments? Councillor Campbell?
Again, ladies, thank you very much for the presentation. Very informative, and we're making some little steps forward. My question, I guess, is do we have the capacity to build over on the system so that more and more people can take advantage of the programs that you outlined here? Really, can we build capacity into the system?
We can always build capacity, Joe, but you know what it comes down to is unfortunately it does come down to a lot of funding, and it's also coming down to, it's going to come down to restructuring, right? It's sometimes difficult to build capacity if we don't have the proper structure in place. So I think to move forward with that, we need to have a good structure, and we have to have a sustainable structure also. And I think we can have the capacity for sure. We've noticed even with these small changes that we've made in our community, you know, Dr. Sampson and I both work in the Emerge. It's been amazing, the people that have come in and we've been able to help in this small period of time that we've had. You know, a lot of people that we come in on a regular basis who now have received treatment and received care that, you know, sometimes they've been asking for quite a while. So yeah, I guess we can have the capacity, and I think we will have the capacity in the future if we continue to build a sustainable structure.
Great. Keep up the good work, and hopefully we can get on top of this thing in the years to come. Thank you.
Councillor Curley?
Thank you, Worship. And I must thank you for the dedication you put into this and your team behind you. In that short period of time, to see the numbers that you've put forward here, it's wow. Like, you've done a remarkable job, and please keep the work going, and your team behind you. Obviously, the city will try to help out whatever they can, but you've made a difference already, and I thank you.
Councillor Robin?
Thank you, Mayor Perry. Quite a lot of work in the last how many weeks? I know my second meeting I came here and I sat down and listened to you passionately talk about the problems, and I came out of here with that Timmins is number one. It's number one in a way I don't really want to be number one in. Mm-hmm. It's also number one in a way that kept me up a couple of nights last. Like, we just start this out and it's like, hey, Corey, guess what? And that's partly due to the culture, the hand waving. It's not a big problem. It came on so suddenly, along with the homeless, so people put it together. All the homeless people are opioid addicts. And that's simply not just, well, part of it's true, but the opioid deaths that are happening, during the last few weeks I've been meeting with as many people as I can to try and learn as much as I can. Of the deaths that are happening, there are very, very few that come from no fixed address. So these are people who are overdosing, who have jobs, who have a place to live, who have a license that has an address in our city. And these are people who are passing away in our grandparents' basements with their kids upstairs. Mm-hmm. These aren't people who you're seeing sleeping on 3rd Avenue. These are our friends and family and neighbors and kids, and these are people everywhere. So I just want to make sure that I come out here and say, being number one in opioid deaths is not a good thing. And that we need to, as a community, have that conversation where we can't group everybody all together and then just hand wave that kind of statistic. And the work that you've been doing to try and make that happen, I'm actually very impressed, and it's totally awesome. Thanks.
Thanks.
Councillor Marks?
No, I was just saying ditto. I know organizational foundations can move at glacier places at times. You've stepped up in this emergency, and thank you. Thank you. This is moving. This is helping residents. It's good.
I think there's been tremendous response, I think, and I'm very, very impressed. Again, Kate sitting at the back, but the interaction and with all the agencies, what you've put in place to save people's lives is phenomenal. And I thank you very much for jumping into this with full steam ahead. So it's great. I think a lot of our problems that we talk about will involve shifting resources. If we talk about the homeless and 22 people that are released early from places like Monteith, if I remember correctly, the cost of housing an individual is over $100,000. And because of the space requirements or limitations in COVID-19. Now, can you imagine if there was a mechanism that a certain percentage of the $100,000, the variable cost associated with that individual might be 75%. $75,000 were transferred into the agencies to help them as when they left Monteith to any other facility that might be there. That money transferred with the individual to help them, because a large percentage of them have problems with addiction problems, mental health problems, but not in the bricks and mortar that they're housed with, but those funds transfer to the agencies to help them. If we're ever going to see this get better, so it's just a different way we must think. And again, it's evidence-based, it's data-driven, and it focuses our asks with all of our senior partners, government partners that are there. This is just a tremendous start. Thank you very much, and my hat's off to everybody involved. Thank you very much.
Thank you.